Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Pharmacy Medicine and today we will continue with mechanical asphyxia. In today's video, we will discuss about drowning. So drowning is a violent asphyxial death wherein there is an entry of air into lungs and entry of air into the lungs is prevented by water or other fluids due to submersion of mouth and nostrils. So again, it is a form of asphyxial death where air entry in the lungs is prevented by water. It may be because of submersion of mouth or nose or both. Complete submersion is not necessary in this case. Submersion of nose and mouth is enough for causing drowning. So coming to a pathophysiology or a viscous cycle of drowning. So when the person, usually a non-swimmer, falls into the water. So usually once he drowns, he starts to sink inside the water in the water body. So once he starts sinking because of buoyancy, he starts to raise up. After few minutes, he may start to raise up, and once he raise up, he try to breathe. So during breathing, he takes a deep inspiration. When taking deep inspiration, some of the water enters the respiratory passage. So once water enters respiratory passage, there is reflex cough reflex is stimulated by present in the cough reflex is stimulated. During violent coughing, the air which is present inside the lung is driven out. So since air is again driven out, he again needs air, and again he tries to take a deep inspiration by going up near the up. He may rise on the surface and may try to deep breathe. Again he continues. This cycle continues till the body is filled with water. Body and lungs is filled with complete with water, and the person completely drowns because of asphyxia. So this is a form of vicious cycle of any condition of drowning. It may be seen in swimmers as well as non-swimmers also. Coming to classification of drowning, it may be classified as two types: atypical and non-typical. Typical, it is also known as wet drowning. Atypical, it may be dry drowning, immersion syndrome, secondary drowning, or shallow drowning. In wet drowning, it may be because of freshwater drowning or saltwater drowning. Typical drowning or wet drowning is also known as primary drowning. Here there is actual obstruction of air passage by fluid. So here actually there is entry of air occurs in the an entry of water occurs in the air passage, which leads to drowning. In other type, it's atypical. Usually the water doesn't enter per se, but there is some water stimulation. Water is present, which causes drowning. Coming to freshwater drowning. So in freshwater drowning, where there is no sodium chloride or brackish water, which consists of about 0.5% of sodium chloride, it is characterized by rapid absorption of water into bloodstream. So since it is a normal water, so water enters the alveoli and water gets absorbed by the bloodstream. This causes hypodilatation, hypervolemia occurs, there is overloading of heart, and then there is hemolysis and rupture of blood vessels. So rupture of blood vessels leads to release of potassium ions into the bloodstream, which leads to hyperkalemia. This hyperkalemia again stimulates the heart, leading to ventricular fibrillations, and death occurs within 4 to 5 minutes of due to heart failure. So if we see the diameter representation, water enters the lungs, and this enters the bloodstream. So bloodstream causes causes hypertonia, hyperhemodilatation, increasing hypervolemia, that is increasing volume of the blood. Again, which also hypervolemia also causes stress, influence the stress on the heart, as well as because of rupture of blood vessels, RBCs, there is release of potassium, which stimulates hyperkalemia, stimulates heart, leading to cardiac failure. So the hypervolemia as well as potassium also stimulates the causes the heart failure. In saltwater drowning, the saltwater is usually about 3 to 4% of salinity is present. Water enters the lungs, and because it is hypertonic, so since it is hypertonic, the water since hence when the salt water enters the lungs, since it is hypertonic, the blood, the water which is present in the bloodstream enters the lungs. So as it enters the lungs, it leads to pulmonary edema. So since water gets accumulated in the lungs, there is edema occurs, and the fluid accumulates the lungs. This results in hemoconcentration. Since most of the water is get absorbed into the lungs, there is hemoconcentration, blood concentration is reduced, there is hypovolemia, and the asphyxia and circulatory shock is followed by that. Pulmonary edema and as well as hemoconcentration, both the cause lead to cardiac failure, since there is decrease in blood supply. blood is decreased, oxygen is decreased in the blood, and there is circulation, and there is hypervolemia. Pulmonary edema is present. Since pulmonary edema is present, oxygen saturation, that is transfer between oxygen between the blood and the tissue, is also decreased. This all leads to cardiac failure. Now coming to atypical drowning, once first is the dry drowning. So in dry drowning, here the water does not enter the lung per se, but there is laryngeal spasm occurs. So which is induced by small amount of water which enters the larynx. So whenever the small amount of water which may enter may cause laryngeal spasm, which again prevents the entry of lungs. So this is atypical drowning, since there is a violent laryngeal spasms occurs. Because of violent laryngeal spasms, most of the water doesn't enter, but because of laryngeal spasm, the air doesn't even enter. It is seen in 1 to 2% of cases. Death is mainly because maybe extremely rapid and time elapsed insufficient to cause typical drowning. So laryngeal spasm is so severe that even the air doesn't enter the lungs and person dies because of asphyxia. There are two mechanisms which is postulated. Mainly, first is the reflex cardiac arrest due to vasovagal shock. So there is first mechanism which they postulate is once the water enters the larynx, because of stimulation of vagus nerve, it may cause cardiac arrest, or because of laryngeal spasm, airway is closure leading to hypoxemia. In both the cases, biological test, mainly the biological test which is done for typical drowning like Gettler's test, is not appreciated, it is not present. So normal findings which are present in the drowning are not seen in this case of dry drowning. Next form of atypical drowning is immersion syndrome. It is also known as hydroception, submersion inhibition, or cold water drowning. So this occurs in four scenarios when cold water stimulates the nerve endings of the surface of the body. So suddenly the person may enter the cold water. Cold water falls on the body. One mechanism. Water striking the epigastrium near the sternum, below the sternum epigastrium. If the water strikes it, cold water entering the eardrums, nasal passage, pharynx, and larynx, or falling or diving into water with feet first, or duck diving by inexperienced person. So in these all cases, the immersion syndrome may occur. This mainly because sudden immersion in cold water may initiate cardiorespiratory reflex. The initial response include immediate reflex peripheral vasoconstriction, increase in heart rate, and increase in cardiac output. So this is seen in typically in few conditions. Whenever we enter cold water, there is sudden vasoconstriction, reflex cardiorespiratory reflex occurs where the person has decreasing vasoconstriction occurs and increasing heart rate occurs in normally. This sometimes in certain individuals may increase the workload of the heart, which may cause vital arrhythmias. This is seen in typically in few individuals where the normal response becomes hyper and the person may have arrhythmias and person may die because of heart failure. The findings again in this case of typical drowning are absent because of aspiration of water into lungs does not occur. Again in this case, since the person just has touched the cold water, the water doesn't enter the air passage and person dies because of either because of vasovagal stimulation or cardiovascular stop. Next atypical drowning is near drowning, or it is also known as post-immersion syndrome or secondary drowning. In this near drowning, it refers to person who survived beyond 24 hours after the submersion episode. So here the person is already drowned, typically drowned, and he was resuscitated, and afterwards because of some complications or sequelae like there may be acute respiratory distress syndrome, pneumonia, sepsis, or ischemic encephalopathy, or cerebroedema, or dysentery intravascular coagulation. So these are all complications may lead to person to die. Next form of atypical drowning, shallow water drowning, is also known as submersion of the unconscious. This occurs in a few individuals among those who suffer from conditions like epilepsy, cardiac diseases, or those who are intoxicated. In these individuals, they are prone, just if they just enter the water, shallow water, like example like a bathtub, just immerse the face, they may be intoxicated or they may have an epileptic episode, and the face, usually the mouth and nose is submerged in water, and this leads to closure and this leads to the person to drown. So here there may be sometimes there may be certain head injury may also be present when he falls down If the person is intoxicated, suddenly fall down into the near the drainage pipes near he may get injury, and the face and mouth and nose may submerged in the water, and person may drown. Just little bit water also is sufficient to cause the person to drown, since nose and mouth is closed in water. Again, in this case, typical findings of drowning is absent. Now, coming to cause of death in drowning, first and foremost, common is the asphyxia, where because there is decrease in oxygen. The electrolyte imbalance, which is seen in fresh and saltwater drowning. Fresh, it is there is a hyperkalemia occurs. Saltwater drowning, there is decrease in salt, increase in salt content. Then there is vagal inhibition due to impact of water, which is seen in sometimes of dry drowning. Laryngismus again is seen in dry drowning. Concussion head injury, which is seen sometimes if the person falls in high places, he may meet with head injury and lose unconsciousness and fall in the water and die because of shallow water. There will be subarachnoid or cerebral hemorrhage. Well, when person may fell into the well or sometimes fell into some river, he may meet with head injury. There may be hemorrhage may occur and person died because of head injury, not of drowning. Then there may be secondary causes like sepsis may also be present. Treatment in case of drowning. First and immediate response is complication of artificial respiration with closed cardiac chest massage. Even in case of absence of pulse or respiratory respiration, cardiac respiratory respiration has to be carried out, since there may be chances of suspended animation is present. Defibrillator may be used in cases if the person is going into ventricular fibrillation is present. Vital period in freshwater drowning it is 4 to 5 minutes. In saltwater drowning it is usually takes about 8 to 12 minutes. Now coming to postmortem examination in case of drowning, these findings are typically seen in case of typical drowning. So in typical drowning, where the person has drowning has fell into the water, and because of that, these findings are seen. In atypical drowning, these findings are not seen. So person in atypical drowning, these findings are not seen. Personal findings in atypical drowning is very inconsistent. Only signs of asphyxia like cyanosis, particular hemorrhages may be present. Other than that, they are not findings of any scenes are not seen. So diagnosis of drowning is one of exclusion, and most of the signs are not specific to death due to drowning and are rather signs of submersion of body underwater for some period. So these are signs are not specific for drowning, but just signs because of the person has submerged in water. When freshly removed from water, usually the body and clothes will be wet. There may be presence of sand, mud particles, and other particles will be present. External findings: the face will be pale, since there is oxygen. Then there is decrease in oxygen. Asphyxia is present. There may be blotted, discolored with putrefaction. This putrefaction is typically seen since once the person drowns, the body falls inside the water. It again after putrefaction, because of release of putrefactive gases, the body raises to the surface. So since because of that, in most of the cases of drowning, the body is already in process of putrefaction. Cyanosis is present. Eyes is found half open or closed. Conjunctiva surfaced. Pupils are dilated. Subconjunctival hemorrhages may be present again because signs of asphyxia. Then tongue may be swollen and protruded again because of putrefaction. Tongue and swollen may be present. Again, if there is lung, water is entered the lungs, because of that also tongue may be protruded. Postmortem irritated is postmortem staining, that is accumulation of blood in the dependent part of the body, which is particularly seen over the face. It is light pink in color. It is seen in face, neck, front of the upper part of the chest, and upper and lower limbs. Has body usually floats in the face down position. So this is typically seen in the face and upper part of the limbs, chest and upper limbs. So that is postmortem lividity is typically seen in that position. If the position is changed, since it is a supine or prone position, if the person is supine, then it will be its postmortem lividity seen in the backside. Next finding is a froth. So froth is present. It is presence as a fine, copious, white shaving lather like foam is present. It is present at the mouth and nostrils and is most characteristics of antimotor drowning. So in any antimotor drowning, this froth is usually seen. It may be absent when wiped off, but it reappears again by itself by applying simple pressure on the chest. So mechanism of appearance of froth in drowning is mainly because of vigorous agitation. So since water enters and closes because of struggling of the person entering of the water through the nose and mouth, there is vigorous agitation of mucous secretions from nose, mouth, saliva, as well as mucous secretion from the nose, surfactant from the alveoli. So surfactant from alveoli also contributes to formation of froth production. Then sometimes aspirated water contains retained air converts. Aspirated water may also contain some impurities which may also contribute to froth formation. This all forms a thick froth which is extracted from the nose and mouth. Next sign is a cutis anserina. So cutis anserina it is also known as goose skin or goose flesh or goosebumps. So this is typically seen cutis anserina in normally whenever the person experience uh, cold, there is erection of the erector pili muscles. Contraction of erector muscles causes the hair to stand up. There is puckering of the skin occurs. So that is also known as goosebumps, which is seen in the normal individuals. But in drowning, it occurs because of contraction of the erector pili muscles because of immersed in when the person is immersed in cold water. So this is a state of puckered and granular appearance of the skin of the extremities because of immersion of cold water and contraction of erector pili muscles. The skin appears like bumpy appears or puckered appearance. Then there is washerman's hand. So in washerman's hand, usually, so this again it is seen in normal individuals. If the person has uh, immersed in water for many minutes or few minutes, there is a wrinkled, sodden, and bleached appearance will be seen. So usually it will be seen in the fingertips as wrinkled appearance. This is seen in drowning since the body is immersed for longer time. So this appears, it may appear in the palms and palms of the fingers, soles of the feet, include palms and press of the toes due to submersion of waters. Again, it is also seen in foot also. So if you see in the foot, there is also we can be seen as in foot also near the sole area. There is a wrinkled, sodden, and bleached appearance will be seen. This is again because of submersion of water and water absorption in the skin leads to this form. This is known as washerman's hand or washerman's foot. Then scrotum and penis gets retracted because of cold. Then because of cadaveric spasm, which is a form of postural appearance where there is contraction, sudden contraction immediately after the person dies. Because of contraction muscles, the person hold anything he is which is holding will be remaining inside the hand. So usually in antenatal drowning, it is a vital proof of antenatal drowning that the person was alive at the time of drowning. There will be presence of grass, gravel, mud, sand, weeds, or aquatic vegetation may be firmly held. So if you open the person's palm, if there is a cadaveric spasm, if you open, and presence of these materials which indicates that the person was alive at the time of drowning. Rigor mortis may appear early, especially when there is violent struggle of life. If the person has struggled, so already person's ATP is lost, and because of that, rigor mortis may appear early. Antemortem injuries may be sustained during fall into water along the tank or by striking against hard objects while diving into shallow water. So if the person has fell into a river or fell into a well while falling down, there may be injuries may be sustained. Now coming to internal findings. So internal findings first in the lungs. Because of absorption of water, the lungs will be voluminous, the lungs will be distended, there will be shallow ballooning, sometimes tenacious, leathery froth may be seen in trachea and bronchi is present. Distended lungs will show indentation of the ribs on the pleural surface. So if you observe the lung, because of distension, there will be a depression will be seen. So near the ribs, where the near ribs are present, there will be the ribs will indent on the lungs. Lungs will be heavy, boggy, and duffy in appearance. It easily indented by pressure of fingers. If you press the finger, it will be get easily indented, and there will be water because of waterlogging. It can easily pressed. Lung may be congested, but often pale or grey in appearance. Tattoo spots that are nothing particularly hemorrhages may be seen as subcutaneous tissues, which may be fewer or none due to compression of blood vessels. There may be mottled areas of red and grey distant alveolus alternating with bigger areas of extravasation, which are also known as plantus hemorrhages. Again, this is because of accumulation of fluid There may be one part of the lung may be mottled. There may be dark patches will be present. One part will be grayish. So this appearance will be present, which is called as plantus hemorrhages. Again, this is because of distant alveolus. If the lung is cut section of lung which exudes copious amount of frothy blood-stained liquid, which is an indication of which is presence of water within the alveoli bronchioles. Pleural cavities may contain blood-stained fluid may be seen. Usually, the overall picture of the lung and respiratory patches in wet drowning has been described as emphysema aquosum. So, these all findings are considered as emphysema aquosum, and it resembles like as because it resembles like a primary pulmonary hyperinflation seen in case of obstructive lung diseases. A drowning lung together with frothy fluid is always diagnostic of antemortem drowning. So, if there is drowning lung, that is all features of lung is present, plus there is a frothy fluid is present, which is always diagnostic of person died because of drowning. Findings in larynx and trachea. There may be presence of sand, mud, slit, dirt, aquatic vegetations. Classic water flora may be present. There may be algae and diatoms which are present in the water may be seen in the trachea, which are characteristics of antemotor drowning is seen. There may be fine white froth may be seen at times of blood. It may be blood stained in lumen, again which is suggestive of antemotor drowning. Because of larynx, trachea and bronchus may be red and congested. In heart, right heart or right side of the heart will be full with dark blood, which from engorged blood venous system. So, because of engorged venous system, blood gets accumulated and becomes dark in color in right side of the heart. Usually, it is fluid in consistency because of mixture with water. One of the biochemical test is done in a heart to determine whether the person died because of fresh water or salt water drowning. So, in Gettler's test, usually, the chloride content of the right and left side of the heart is normal, which is 600 mg per 100 ml. So, in right and both right and left side of the heart, chloride content is normal. But difference of 25 mg percent is more or suggestive of antemotor drowning. So, if there is a difference between both right and left side, if it is more than 25 mg percent difference is there, it indicates it is an antemotor drowning. And in case of freshwater drowning, in freshwater drowning, the water is normotonic. There is no salt content. Because of that, chloride content of the blood of the left heart will be lower because it is diluted. Since because of dilution of water, left side of the heart will be chloride content will be less compared to right side. In case of saltwater drowning, chloride content of left heart will be greater since it is hypotonic fluid. The chloride content will be more because of heavy concentration and mixing with the salt water. These are the three findings which we seen in the Giller's test, where chloride content of right and left side will be estimated. Coming to stomach and small intestines. Stomach and small intestines may contain about water in 55% cases. Sometimes, if the water sometimes enter the lungs as well as the small stomach, which corresponds to drowning medium like muddy water. If it similar to if the water represents the stomach and small intestine is examined and compared with the drowning medium, if it is same, it indicates that it is a person is died because of antemotor drowning. Water is not found in stomach if the person died from shock, syncope, or because of that is postmortem of the if the person had died, then there will be not fluid, or person died because of dry drowning also. There will be no fluid, no water will not be present. Small intestine may also contain water in about 10-20% of cases. Brain, there will be congested gray matter, typical finding of asphyxia will be seen. Then again, other findings, liver, spleen, and kidney will be congested. Again, in middle ear, there is presence of water hemorrhages in middle ear, which is claimed to be a finding of antemotor drowning. There may water may be entered the ethmoid and spinal sinuses may be present. Then diatom test is done to determine whether the person died because of antemotor drowning or postmortem drowning. Diatoms are usually the microscopic unicellular algae which are present in the freshwater waters. They vary in size from 5 to 400 micrometer in shape and have hard shell made up of silica, which usually resists acid digestion. During drowning, these diatoms may enter circulation and may be transferred to other parts of the body like brain, liver, kidneys, and bone marrow. So, if the diatoms are present in these organs, which indicates that the person may be alive. The procedure of diatom during diatom test. Usually they take about 2 to 5 grams of organs, usually liver, spleen, kidney, and brain is taken, or 40 milligram of bone marrow is taken. Then nitric acid is added, which dissolves the normal tissue. Other tissues dissolves except diatoms, which has a silica wall. This is done boiled for 10 to 15 minutes. Afterwards, it is centrifuged. After centrifuge, the which is outer upper part is discarded and which is subsided. Again, it is centrifuged. Then deposit which is present is microscopically examined under the microscope for presence of diatoms. If diatoms are present, it indicates that the person is confirmed as antemortem. If there are no diatoms, it doesn't exclude the drowning. Since many times even complete negative analysis of the diatoms does not rule out drowning, since it is not a confirmed test. It just gives the idea that whether the person may be alive or not. Coming to medical questions, which may be seen in case of drowning. First and foremost is whether the person died due to drowning or not. Drowning is most difficult modes of death to prove at postmortem, especially when the body is not examined in fresh conditions. In doubtful cases where the definite opinion is not given, visceral body fluids should be preserved for chemical analysis. So, to confirm whether the person died because of drowning is very difficult, since many times the body is already in petrified stage and it is very difficult to confirm. Usually, the body should be preserved, body viscera should be preserved for chemical analysis. Next medical question is whether the person was whether it was accidental, suicidal, or homicidal drowning. Accidental stress drowning is seen in case of children's, bathers, fishermen, in case of dock workers or intoxicated persons or epileptic persons. Usually, women may fall off when they try to remove water from drowning or drawing water. It may be seen in case of children's, if case of prostate labor, if the woman is doing bath, then the child may be fall in the pan or die. In case of suicidal drowning, is the commonest in India, especially in females. Sometimes the woman may take the child with her and die. If the adult is found down in shallow water, the presumption is usually the suicide. So if the body is found in the water, it is always presumed that the person had died because of suicidal condition. Homicidal drowning, it is also not very common since the person may be killed before drowning and thrown in the water to stimulate the person and died because of suicide. In these cases, many types of injuries may be found in case of the person had been stabbed or any injuries of the homicidal injuries may be seen. It is very easy to drown a person without leaving a suspicious mark behind, especially if the person is nauseous or intoxicated. Victims of homicidal violence may be placed in water after death in order to dispose of the body. These are my references. Thank you.